In our India, legal adult is 18 years, but marriage 21 years. So এরকম হচ্ছে এই যে ডেফিনেশন গুলো, দিস কাইন্ড অফ ডেফিনেশনস ইউজুয়ালি these kinds of definitions are now usually made by either our law system, and we had a different system made by WHO, sometimes Ministry of Health and Family Welfare. তাহলে ফার্স্টে today's topic is adolescents. Okay, so who are adolescent? Are they adults or are they childs? In between, correct? 3 types of definitions WHO gave us. Okay, one is adolescent, one is young adult, and one is youth. Okay, youth is usually 10 to 24 years, adolescent 10 to 19 years. Okay, these two are asked very frequently, so please note it down. Youth are 10 to 24 years, adolescent are 10 to 19 years. Okay, so today we are dealing with people living in 10 to 19 years. As per last report, that came on 2018, almost 21% of our India's population belongs to this category. So now in 2026, the number is much more, not the less. Okay, and if I go by number, as per the report, that is 253 million. So what is adolescence? That's a stage of human development encompassing the transition from childhood to adulthood. It's a Latin word usually, and what's the physiological change? That is puberty, biologic change and sexual maturation during this transition. Okay, this I already discussed. Then demography. Right now adolescents are 1/5 of the total world's population. Okay, only remember this one. This is a previous, but it is not verified. I searched for literature, but this 22.8 is cited in some journals. So if come in your MCQs, you must state, even in your answer scripts, you must state 21%. Okay. Now what are the special characters of those adolescents? That first, rapid growth in all aspects. Growth can be physical, growth can be hormonal or physiological, and also psychiatric growth or psychosexual growth is also one of the domains. Okay, and also we have to deal with social development. Usually in adolescent we became social. Okay, before that we are not that much a social animal. Okay, usually below 10 every child is somewhat kind of selfish, doesn't want to share his toys or anything, but after 10 the social development also occurs. যদি মনে করে দেখো স্কুল টাইমের যত বন্ধু হচ্ছে গিয়ে তোমাদের তৈরি হয়েছে, সেগুলো হচ্ছে হাই স্কুলে ক্লাস 5-এ এসে, তাই তো? প্রাইমারির বন্ধু ইউজুয়ালি কিছু মনে থাকে না, যদি না তোমরা 1 to 10 সেম স্কুলে পড়েছো। যদি তোমাদের বারবার স্কুলের ট্রানজিশন হতে থাকে, ফার্স্ট হচ্ছে গিয়ে বন্ধু যার সঙ্গে এখনো তোমাদের কানেকশন আছে, দ্যাট ইজ ক্লাস 5-এ হাই স্কুলে যার সঙ্গে বন্ধুত্ব হয়েছিল। ওকে, also what are the specific characters? There will be sexual maturity and onset of whatever. Again, experimentation is there, transition, also there will be transition from total socio-economic dependence to relative independence. 10 পাস হলে পকেট মানি কিছু অনেক সময় জোগাড় হয়, তাই তো? এবার নিজের খরচটা নিজে করো, অ্যাটলিস্ট পেন আর খাতার টাকাটা হচ্ছে গিয়ে পাওয়া যায়, বাঁচিয়ে অন্য কিছুও কেনা যায়। ছোট হলে বাবল গাম, আর বড় হলে হোয়াটএভার, আমরা যেদিকে তোমাদের যেগুলো শখ। ওকে, and also onset of reproductive cycle and development of adult mental process and adult identity. Usually in adolescence, people try to make their own identity. Your hobbies also develop in this stage. Also there are some physiological stages which divided, that is early, that is 10 to 13 years, growth spurt and secondary sexual characters which we known as puberty. Mid-adolescence is 14 to 16 years. Usually it addresses with independence and identity experimentation, and late adolescence is 17 to 19 years. মনে করে দেখো মাধ্যমিক দিয়ে প্রথম নিজেকে ফার্স্টে মনে হয়েছিল যে হ্যাঁ একটা কিছু পরীক্ষা দিয়েছি, এবং 11-এ হচ্ছে গিয়ে উঠে লোকজন সবচেয়ে বেশি উঠতে শুরু করে, কেউ অস্বীকার করবে না। হ্যাঁ, 11-এ এসে সবচেয়ে বেশি উঠতে মানুষ শুরু করে, দ্যাট ইজ 14 to 16 years. Then coming to the late adolescence, এই সময় খানিকটা হলেও in this time usually some responsibility you have to bear on of the family or anything else. Okay, usually this is the age 17 to 19 where a large proportion of your adolescents entered into the workforce. Okay, usually in the non-government sectors, চায়ের দোকান হতে পারে, হোটেল হতে পারে, এমনকি নিজেও দোকান খুলে বসেছে এমনও হচ্ছে গিয়ে দেখেছি। Usually this is the late adolescence, যখন হচ্ছে গিয়ে ফ্যামিলি রেসপন্সিবিলিটি he or she has to bear. Now what are the growths we see in the adolescent? That is first physical growth. Under physical growth we usually see skeletal growth, and there is a change in the body composition. Usually there is weight gain, increase in adipose tissues in the girls, increase in muscle mass in the male species, and also as per skeletal growth there are secondary growth spurt. Okay, what is the time of the primary growth spurt? কখন হয় প্রাইমারি গ্রোথ স্পার্ট? এটা তো ফিজিওলজির কোশ্চেন। ভালো উত্তর পেয়েছি, যেই বলুক। And also we usually see the maturation of the reproductive system because of onset of the secretion of reproductive hormones or sexual hormones. Usually there is increase of FSH, LH, estradiol, testosterone. Also the appearance of secondary sexual characters happens at this stage. Okay. Also coming to the psychosocial development, less interest in parental activities. ওই যে বললাম উঠতে শুরু করবে, so we try to flee from our parents' control. That's why in some European countries and also our favorite USA, there is a term that is emancipation. Emancipation, you know what is that? আমাদের হচ্ছে গিয়ে ওই ইয়ে করেছিল, কি বলে, গান গাইতো হাই স্কুল মিউজিক্যালে, কি নাম দিয়ে, Justin Bieber, he also went by emancipation. What was his problem? His mother was too controlling, so he sued his mother, and emancipation is nothing but that you are now responsible of your own, but the age is his age was by then only 16 years. He complains that what I am earning, my mother is spending all the money. ঠিক আছে? And আরেকজন হচ্ছে কি ইয়ে ছিল, Selena Gomez also. She went by emancipation, and her problem was her father. Okay. There were also usually mood swings are very common. Increased cognition, increased need for privacy, lack of impulse control, increased intellectual ability even. এই সময়টায় তর্ক করতেও খুব ভাল লাগে যতটা, and also the risk taking behavior. We also maximum accidents or road traffic accidents happens at this age. Okay, these things, you know, Now coming to the only problems, okay, I am making it short. What are the adolescent health problems? Usually we see first biomedical illness, usually congenital malformation or defects detects at this stage, okay. Right now we have many screening tests to detect congenital malformation, but if the person skip those things, usually at this stage the congenital malformation or defects are detected. Also we know about precocious or delayed puberty. What is the normal time of puberty and what is precocious and what is the delayed? What is the normal range? What is the normal age of puberty? একটা রেঞ্জ জিজ্ঞেস করছি তো, মানে একটা লোয়ার লিমিট থাকবে একটা আপার লিমিট থাকবে, কত? হ্যাঁ 10 থেকে 12। তাহলে প্রিকসিয়াস কখন বলবো? ইউজুয়ালি 9, তাই না? And before 10. This is all for Indian subcontinent, okay. And what is delayed? এটা কিন্তু 12 নয়। What is delayed? মাঝে একটা আমরা রিলিফ পিরিয়ড দেওয়া আছে 12 এর পর, এই টাইমেও হলে আমরা নরমাল ধরে দিই। অ্যাপিয়ারেন্স এন্ড 14 কমপ্লিটেড, ঠিক আছে, এখানে কোনো আপার লিমিট আর থাকবে না, তাই না? And also usually there are problems of short stature, asthma, and obviously tuberculosis and malaria, because right now adolescents are going outside more, getting mingled with other people, so the chances of contracting tuberculosis or even malaria or any other contagious diseases are more at this stage, okay. And obviously there are consequences of risk taking behavior, unintended injuries, automobile or sports, intended injuries, violence of homicide, suicide even, okay. STDs also, it is very rampant, and teenage pregnancy even, okay. And the problem of substance abuse, okay. Usually it is very much more seen in adolescent problems, okay. Here are some statistics. Just see how 1 lakh suicide in adolescent, okay. It was 1 lakh suicides. When the report has been written, it was written as 1 lakh suicides happened in the last decade among adolescents, okay. The number is much more round. STI and HIV is also 2.6 million. Out of STIs, 50% attributed to HIV, okay. And also 32% of the adolescents are aware, but the practice, the data on practice is still not available, okay. Awareness is there, but practice is not available. Also substance abuse, 4 to 4.5% of 12 to 17 years people are now addicted, okay. Also there are nutritional problems, malnutrition is there, obesity is there, eating disorder. What are the eating disorder? Bulimia nervosa, Anorexia nervosa, and what is bulimia nervosa? খাবে তারপর হচ্ছে গিয়ে রাত্রেবেলায় দেখবে হঠাৎ করে বমির আওয়াজ আসছে, দেখবে সে আঙুল ঢুকিয়ে নিজে বমি করছে, ঠিক আছে। Usually these are seen in almost 50% of the girls. And also this, what is IDD? What is IDD? Iodine deficiency. It is seen in 6 to 12 years, almost 30 to 50% of 6 to 12 years. And also there are reproductive health problems, first coming teenage pregnancy. Then there are abortion related problems, menstrual problems, and reproductive tract infection, okay. Just if there is a short note, write down the problems of the adolescent. You have to write these domains first and only these lines. Statistics even you do not have to give, okay. And another domain is mental health problem. So again, coming to the substance use, there are violence, depression, also usually learning disorders also usually detected in early in the adolescent, okay. Before that, usually parents usually overlook the learning problem or think that the child is not concentrating, that's why his or her results are poor. But that's why in our case, in our country, learning disorders usually detected in the early of the adolescent, that is usually class 6, 7. তার আগে প্যারেন্টসরা ভাবে যে ছেলেটা মন দিয়ে পড়ে না, ওই জন্য পাচ্ছে না। Usually there are three kind of factors, some underlying factors, some high risk behavior and immediate causes. Those all are interrelated. Suppose underlying factor, one child is presented with violence problem, okay. So what kind of causes we usually think, what is the immediate cause? Obviously, suppose he attacks his school friends, so probably there are bullying or provocation, that is the immediate cause. And also there is high risk behavior, probably. What is the high risk behavior? He attacks, that's why. Why? Where he learns how to fight. Probably, আচ্ছা এই ইয়েতে তোমরা অনেকেই হচ্ছে গিয়ে WWE দেখতে, তাই তো ছেলেদের দল? হ্যাঁ, এখনো দেখো হয়তো। হ্যাঁ, সামার স্ল্যাম, রেসেলম্যানিয়া। তাহলে কেউ যখন অ্যাটাক করছে তখন যদি ওই ইয়েটা করে যে হ্যাঁ আমি চোখ স্ল্যাম দেবো আন্ডারটেকারের মতো, ঠিক আছে, তাহলে হোয়াট ইজ হিজ হাই রিস্ক বিহেভিয়ার? যে ওগুলো দেখে, ওর হাই রিস্ক বিহেভিয়ার, ওকে যখন কেউ প্রভোগ করেছে, ও কিভাবে অ্যাটাক করেছে ঠিক করেছে, কিভাবে অ্যাটাক করবে কিছু একটা ওখানে শিখেছে, ঠিক আছে। কি জন সেনার ইউ ক্যান্ট সি মি, দ্যাট ইজ অলসো দেয়ার। চা খুশিও করতে পারে, কিংবা হচ্ছে গিয়ে আর কি ছিল ভুলে গেছি, আমিও দেখতাম। And what is the underlying factor? Probably violence is very common in his household, okay. That's why these kind of domain or causes or factors you have to check, okay. In future, if any one of you went into psychiatry, this is how you have to think for every patient. Even for depression, you are seeing that probably you are acting now as a counselor, MO plus counselor in a AFHC, okay. I will come into AFHC, and you got a patient, there is a school health program also, and for school health one patient is referred to you. I think in some private school there are school counselor also, where trained psychiatrists usually are appointed once a month or once a day basis, okay, once a week basis, okay. Usually right now they do not want to afford MBBSs because we charge much more. এটা এইগুলো খেয়াল রাখতে হবে, সব কাটতে হবে শুনে নাও এখন, okay. But usually that's why you see one student of depression, okay. You also have to think like that, what are the also bullying in class, that's why he is depressed. Also might be he is also getting scolded, beaten in his household, and there might be some high risk behavior also. Probably he is addicted to some drug. Is very much available in school premises. So that's why some list of these factors are given. What are the underlying factors? Might be gender-based discrimination, poverty, unemployment in the family or parents, urbanization, migration, social values. Sometimes migration, even school change, that is migration, or going to a different school or changing your state due to some your parents' job, even this kind of thing usually affects you. Even some problems in the family, just like divorce of the parents, it affects highly a adolescent, okay. And also war and emergency, the universal cause. What kind of immediate causes we see? Sometimes inadequate education or skill, poor access to health information and service, exploitation and abuse, unsafe or unsupportive environment among the family, friends, even in the policies and the media. তোমরা OMG 2 দেখেছো তাই তো? হ্যাঁ, OMG ও মাই গড 2 অক্ষয় কুমার ছিল, দেখোনি? হ্যাঁ দেখেছো তো? দ্যাট ওয়াজ কাইন্ড অফ এ, ও যদি ওখানে অ্যাক্ট আউট করতো, দ্যাট বয় ট্রাইড টু কমিট সুইসাইড, that was a risky behavior. Why? Because he was bullied at school, home, no one was supported him. Okay, what he does done. And what are the risky behaviors? Psychosocial disorders. There are also some physiological or biological risk factor, behavioral risk factor, or situational risk factor. Okay, just remember and you have to write. Why adolescents are important? There are usually 3 exact points. I will come to it later. Just now remember, they are obviously a demographic force, because those who are now adolescent, they will become adult and they will contribute to the economy of our country. One easy point. So it is covered the first 2 points, and also they are the future of the health and they have a right to the participate. Always the humanitarian cause. That's why adolescents are important. Okay. So how we prevent these problems? Okay, what are the primary prevention? Obviously making policies, making available of information and everything. That is what happened in RKSK, that is Rashtriya Kishor Swasthya Karyakram. These are the policies and programs. Now what are the secondary prevention? Secondary prevention কাদের জন্য হবে? Those who are already affected. Usually that's why those previous statistics were given, how much of each year affected. We have to identify them and the reduction of the risk even. Okay, what is the reduction of the risk? Suppose we have to identify those who are addicted and we have to reduction the risk of those adverse effects of substances. Okay, if long term of consumption of alcohol leads to liver failure, so we have to reduce those risks. And what are the tertiary prevention? Treatment and rehabilitation. Tertiary prevention usually suppose some teenage pregnancy. Okay, if we have time, we have to give abortion services even, or abortion packages, or we have to reduce the sexual those behavior. We can ask them to use contraceptives even. Okay, these are the tertiary prevention. And obviously rehabilitation, those who have already committed an act of violence or act of depression, we have to treat them. And or sometimes there are also addiction free করার যে clinic, addiction rehab, we have to send them there. Those are kind of tertiary prevention. Okay, here are the lists. So what are the sources we can identify for adolescent? Obviously first there are schools, but does everybody go school? No, there are school dropouts. That's why we also have to put general health service and special health service. Special health service to identify or to reach to the school dropouts. Okay, because they are school dropout. Why? Because they are now employed in some place else. That's why. And obviously there are social marketing, that is making posters, ad and everything. Okay, and one thing is added in the adolescent health, that is menstrual hygiene. A good personal menstrual hygiene very important. What are the advice? Usually take bath daily, use cotton undergarments, wash with soap and water after toilet. Usually in menstrual health MSH or menstrual health services are employed through school or AFHCs. Okay, and also now we provide sanitary napkins at a very cheap rate by ASHAs. Usually 6 napkins at one napkin is rupees 1. Okay. So 6 rupees for one packet. One packet contains 6 napkins. That is a service which is even we provided either by door to door by ASHA workers. It is also available in the school and AFHCs also. Wherever you can get. Okay, there is also now dispensers, and also beside the dispenser there is one incinerator. Okay, you can যেমন হচ্ছে গিয়ে আমাদের কোল্ড ড্রিঙ্কস এর এগুলো থাকে 20 টাকা মেরে হচ্ছে গিয়ে কোকা কোলা টিপলে কোকা কোলা বেরোবে, ইএমএল এ পেপসি বেরোবে, বাটন আছে ওই রকম তুমি 5 টাকা 6 টাকা হচ্ছে গিয়ে দিতে হবে। ইউজুয়ালি 5+1 অথবা 3-2 ওইভাবে ওইগুলো প্রোগ্রাম করা আছে। যেমন মেট্রো স্টেশনে হচ্ছে ওয়েইং মেশিন গুলো আছে, সেম দেবে হচ্ছে গিয়ে যেমন টিকিট ডিসপেন্স হয় তেমনি হচ্ছে ন্যাপকিন ডিসপেন্স হবে। এবং তুমি তোমার এবং used napkin also can be incinerated behind, just the incinerator is the beside, you just have to also, that is free, incinerator service is free. Okay, what are the barriers, it might be asked in your viva for utilization of this health service. First is fear. Okay, sometimes is uncomfortable with the health workers, concerns about the confidentiality, that is the largest problem, because adolescents now try to be independent and they try to want to solve their own problems. So they usually concerned about asking a elder person or a specialist, our news might not be confidential. And also sometimes parental consent is required. You cannot abort a teenage pregnancy without their parents' consent. You have to inform your parents. So there is always a concern. And also some operational barriers also, the cost, location, obviously our country is not a rich country and very much only 2.5% of our GDP is allocated to health sector. These are the UNICEF or WHO guiding principle, and what WHO suggests, that teach the adolescent life skills. Okay, আমাদের বাংলায় এটা ছিল জীবন শৈলী। ক্লাস হয়েছে কখনো 7, 8, 9, 10? না, আমাদের সময় না টিচাররা পড়াতে চাইতো না আমরা পড়তে যাইতাম, ক্লাস হলে আমরাও পালিয়ে যেতাম স্কুল ছেড়ে বা মাঠে খেলতে চলে যেতাম, বাট দ্যাট ওয়াজ ইম্পর্টেন্ট। সো হোয়াট এভার, উই অল লার্ন আওয়ার ওন ওয়ে। হ্যাঁ, লাইফ স্কিলস হচ্ছে গিয়ে কম্পোনেন্ট কি, এগুলো হচ্ছে তোমাদের যেহেতু WHO দেওয়া, এটা হচ্ছে কি অল্প একবার চোখ বুলিয়ে রাখবে পিপিটিটা থেকে, ঠিক আছে? কোনো MCQ আসলেও আসতে পারে, ঠিক আছে? খুব পুরনো ইয়েতে হচ্ছে কি লাইফ স্কিলের ডোমেন থেকে আসতো, অনেক দিন আসেনি, তার মানে এই নয় যে আসবে না, কেননা দিস program is still followed. Okay, what are the significance, how is primary problem, what are the educational ways, dynamic teaching, working in small group discussions, sometimes role playing, these are the ways of giving the life skills. And what are the components also, these are there. Okay, this is only the problems. Now what India government has done, that is coming for RKSK. Seeing this in 2014, okay, India government first launched RKSK. Okay, that is Rashtriya Kishor Swasthya Karyakram, that is RKSK. But is if it is RBSK, then এটা রিপ্লেস হয়ে যাচ্ছে কি দিয়ে, বাল, রাষ্ট্রীয় বাল সুরক্ষা কার্যক্রম। ওকে, মাথায় অন্য কিছু আপাতত এনো না। হ্যাঁ, so and it becomes a part of the RMNCH+A strategy. So RMNCH strategy হচ্ছে গিয়ে কি, it enters what is the RMNCH+R? কে কোন লেভেল পেরোলো? What is the R? But what is RMNCH+R? Reproductive. M N C H, and what is A? adolescent. It has been added. Usually in our own NHM website there is a picture of umbrella. Okay. This is the umbrella program. Under one program, multiple sector of the society are covered. Okay. This is the largest and one of the important initiative under EQLO. So what are some core area of RKSK health promotion and community based approach? We now have expanded our scope. We added nutrition, SRH, that is sexual and reproductive health, injury, violence, non-communicable disease even. Okay. It is launched on 7th January 2014 across 231 districts in the country. Now it has been employed all over the country. Okay. What are the objectives? First, improve nutrition, enable sexual and reproductive health, enhance mental health, prevent injuries, prevent substance misuse and address conditions for non-communicable disease. These are the points you have to say in your viva. What you have to write, I will add in the slide later. Okay. There is simple tabular picture, try to copy it. Okay. The examiner will give the full marks. What are the strategies we employed? First is we try to do some facility based intervention. So we established AFHCs, okay, that Adolescent Friendly Health Clinics, and there will be an approach through community. We try to do peer education. What is that? That is Sathiya. Have you heard about it in CM? What is Sathiya? I will come to it later. Okay. And also quarterly Adolescent Health Day. Quarterly, that means once in a 3 month in your school, 1 day on adolescent health. 1 day in adolescent health will be taken. Okay. That day is for adolescent only. What are the curriculum and what happens? I will come to it later. Then weekly iron and folic acid supplementation, that is WIPS, the largest deworming program all over the world, and Menstrual Hygiene Scheme. Okay. That is WAS. WAS you know, na? WAS activities. Okay, what are the strategies that are to Convergence RKSK with other running programs? Suppose tobacco, that is a problem. If the adolescent is having problem with tobacco misuse, we also have some law, that is COTPA, and we also have national program for control of tobacco. We can converge with them. Also we can converge with, if there is risk behavior of NCDs, we can converge with national program of NPNCD. These are the risky behaviors we usually try to identify it. Okay. One, it is not seen na correctly. Sorry, just read in the PPT later. If there is any problem, I will explain it to you. Now, why invest in the adolescent? These are the points you have to write in your copies. That first, demographic dividend. Okay. It will reflect, you know about the demography and you know about the problems, and you can compare with them. Again, shifting the burden of disease. 53% of the total deaths in India now due to non-communicable, compared with 40% in 1990. So if these adolescents are having risky behaviors, this number will increase or not. 53 might become 60% or 70%. That's why we have to address. Okay. And there are the adolescent vulnerabilities which is easily preventable. That's why we are focusing on the adolescents. What are the vulnerabilities? This is the list. I already discussed in previous slide also, that malnourishment, unintended or unwanted pregnancies, maternal mortality is also higher in the adolescent, infant mortality or incidence of STI, violence or unwanted sexual activity, prone to accidents, suffer from mental health problems. So we actually, RKSK objectives are divided into 6 key themes. First is healthy lifestyle, promote. Then practice violence free living. Again, improve nutritional status. That is why in ICDS the adolescent girls are also added, okay, because they are more prone to get anemia. So we have made WIPs and all ICDS or midday meal scheme, those all comes under this objective, improved nutritional status of the adolescent. Also prevention of substance misuse, promotion of safe practice of reproductive and sexual health, and better mental and emotional well-being. This is the 5x5 matrix for RMNCH+A, and adolescent is 5, okay. Try to remember, because RMNCH+A program, it might come. This last year came one nutritional program. So this year some non-nutritional, obviously it might be RMNCH, it might be TB. আমি হচ্ছে কি একটা টিবি at a glance পোস্টার শেয়ার করেছিলাম, সেটা দিয়েছিস তো? Try to make a poster like that, okay, for every program. যদি ওগুলো হচ্ছে কি বানিয়ে নিজের চোখের সামনে থাকে তোমাদেরই ভালো হবে। আমি তো পরীক্ষা দিয়ে দিয়েছি, আর দেবো না, তাই না? তোমাদের ভালোর জন্যই দেওয়া। So there are 7 C's. It is very much asked in your exam, okay, for RKSK strategies. First C is coverage. What is the coverage? That is 10 to 14 years and 15 to 19 years. In school and also out of school, urban and rural, married or unmarried, all will be covered under RKSK. Second is content. That is the package of services. Sexual and reproductive health, nutrition, NCD prevention, injuries, mental health, substance misuse, all of them. Next C is what? Communities. Community based approach. What are those? As I said earlier, peer educators or Sathiyas will be there. There will be school health program even, okay. Fourth C is clinics. Usually in one MCQ to remember, AFHC starts from CHC, okay. What is CHC? AFHC, that is clinic, always starts from CHC level. তার নিচে PHC বা সাব সেন্টারে কোনো হেলথ ক্লিনিক থাকে না, সেখানে থাকে অনলি ওয়াক ইন AFHC, ওকে, ওয়াক ইন কর্নার। সেখানে অনলি এডুকেটার্স, that is adolescent educator or peer educator or counselor থাকে, কোনো ডাক্তার থাকে না। ইভেন PHC তেও, এমনিতে PHC তে ফার্স্ট হচ্ছে we used to get contact with a medical doctor, but PHCMOs are only GDMOs. They are not trained in AFHC problems, okay. So remember, sub center there are only walk-in clinics, AFHC and PHC, that this thing it is not happened, okay. So remember that MCQ only. And also AFHC in the community health center, AFHC in district hospital, and AFHC in medical college. Usually AFHC গুলো হসপিটাল বিল্ডিং এর পাশে তৈরি করা হয়, একই ক্যাম্পাসে, বাট সেপারেট ফ্রম নর্মাল হসপিটাল। কেন? কনফিডেন্সিয়ালিটির জন্য। তো ওখানে যদি হসপিটালে ঢোকে হচ্ছে কোনো টিনেজের কোনো প্রবলেম আছে, অ্যাডোলেসেন্ট কোনো হেলথ প্রবলেম নিয়ে ঢুকলো, ঢুকেই দেখছে চেনা কেউ অন্য লাইনে দাঁড়িয়ে আছে, there will be a problem. That's why. And also AFHC usually do not advertise that this is AFHC, এখানে আসো, লাইন দাও। It is not at all look like a clinic. That is a one strategy also, okay. Again, fifth is the counseling, barefoot counseling at the community level. Usually ASHA workers usually done that, and dedicated and trained counselors at the facilities, CHC or upper level. Last C is communication, 6C, okay. 360-degree approach, write this word only, okay. 360-degree approach and you will get full marks. That means we are covering all the platforms, social media, telemedicine, all the aspects, school. Also there are now clubs also, adolescent friendly clubs, that's called AFC, okay. Do not get confused. If the question comes with AFC, that is adolescent friendly clubs. Even under RKSK, they are given 500 rupees per month to conduct the adolescent friendly clubs, okay. Last C is Convergence. Here all the ministries are written, you cannot remember this. So try to think about the health problem and all the problem and the related health program. As I said, that's nicotine abuse, so COTPA or National Program for Tobacco Control. So what are the 7 C's? First is coverage, second is content, third is community, last is clinic, then counseling, then convergence and communication. Last is, what was the last? Communities was the 6th. What was the last? Convergence. These are the programs or package of services that are given. Adolescent Friendly Health Clinic, weekly WIPs, scheme for promotion of menstrual hygiene, peer educator program or quarterly adolescent health day. These are written short. Now coming to the arts or adolescent or reproductive and sexual health program, under that AFHC. AFHC might come as a short note or even a long question, okay. In your 10 marks जो question होता है उसमें AFHC आने का सबसे ज़्यादा importance है, because AFHC has many things. Right now just remember 6,000 AFHCs are functional across the country and covering almost 2.5 million adolescents. Is it enough? How much adolescent is there? 253. We are covering only 2.5. It is less than even 10%. What are the service package? First is information corner. In every AFHC there are information corner. If you want to know about something, you can go there. You do not even have to meet the doctor, okay. You do not even have to get the advice of a doctor. There are information corner. Also, what are the commodities that to be kept in MAFHC? What is MAFHC? That is a model AFHC, okay. What should be there in AFHC? That is MAFHC, model AFHC. First is iron, folic acid, sanitary napkin, contraceptives, other medicines such as paracetamol, antispasmodic, first aid, pregnancy testing kits, body mass index charts. If there is body mass index charts, we have to have their weighing machine. And how we measure height in a proper setting? What is the name of the machine? Height measuring machine ki naam? Stadiometer. And also what are there? RTI or STI management, antenatal care if there is problem of the teenage pregnancy, counseling on these all the things, management of menstrual problems. Try to remember as much as possible. You have to write in your long question, okay. And for counseling service, you have to remember these points. The counseling should be equitable, accessible, acceptable, appropriate, effective and comprehensive. If there is a point or short note on the peer based counseling, you have to write these points, that counseling should be equitable, accessible, comprehensive, acceptable, appropriate and obviously effective, okay. So I told about Sathiya. Sathiya is a what to say, effort. Who can be a Sathiya? Usually same a person who is trained in this counseling process of your same age, okay. They are not sitting in the FHC. Usually they try to form a 10 to 15 groups, a group of 10 to 15 girls or boys and they usually held a weekly or monthly or bi-weekly meeting. The one he or she try to usually listens to the other's problem and counsel them or advise them what to do. That is Sathiya, okay. And for Sathiya, is he or she getting remunerated? No. The age, communities and school will be same, just like ASHA worker, okay. Come from the same community, but this is no remuneration or incentive based. He will be given a certificate only, okay. Because গভর্নমেন্ট স্কুলে হচ্ছে অনেকেই এগুলোর জন্য অ্যাপ্লাই করে বিকজ ইট লুকস গুড ইন ইয়োর রেজুমে লেটার, ওকে, or CV. What are the important issues that covered in the counseling? That is nutrition, puberty, delayed marriage and childbearing, premarital concerns, substance misuse, everything. Usually, right now 881 dedicated arts counselors are providing by 231 districts, okay. And there are some outreach activities, that is VHND. It might be also an important short note in your second paper, okay. CM second paper, Village Health and Nutrition Day and what has been done on those days, what activities, VHND or VHSND. Now Village Health, Sanitation and Nutrition Day, same thing. It's an important short note, okay. And also on those days, arts activities are also happen. What activities? That community outreach activities. They might set up a camp or there might be role play or anything. Whips. What is the dose of the whips? লেখা আছে, ও লেখা আছে। What is the dose of the whips? 100 mg। আর তাহলে প্রেগন্যান্সির ক্ষেত্রে ডোজ কত? whips এর কালার কি? হ্যাঁ, তো এজ ওয়াইজ আর ইয়ে ওয়াইজ বলো। একটা 45 আর এখন 100 নয়, এখন 60, জন্য আমি রেখে দিচ্ছি 100টা ওখানে। আর যদি প্রেগন্যান্সি হয় তাদের হচ্ছে রেড, আর উইপস এর জন্য হচ্ছে গিয়ে ব্লু, খানে কি নীলি গলি। হ্যাঁ, বাচ্চাদের হচ্ছে সিরাপ। And also there are screening for moderate and severe anemia. এই জন্য ফ্যামিলির সময় আমি সবার অ্যাটলিস্ট প্যালটটা বলি, করে দেখাও আমাকে, বিকজ দ্যাট ইজ দ্য বেসিক থিং। তুমি সবার ফার্স্টে প্যালট চেক করবে, তারপর হচ্ছে কি হিমোগ্লোবিনোমিটার নিয়ে হচ্ছে গিয়ে চেক করবে, তাকে সন্দেহ হবে। 100 সবাই যত স্টুডেন্ট আছে সবার যদি ফোটাতে যাও তাহলে তো বিপদ হবে না। And also the biannual deworming day. What are the deworming month? Usually in school health program, আর ওটা অ্যালবেন্ডাজল তো ডোজ, আমি বলছি ডে কোন মান্থে করা হয়? জুলাই একটা, আর বাই অ্যানুয়াল বলা আছে। এটা যদি জুলাই হয়, 7 আর 6 কত হয়, বা 7 থেকে 6 মাইনাস করলে কত হয়? জানুয়ারি আর জুলাই। বাট ডিওয়ার্মিং ডে উই সেলিব্রেট সামটাইমস অ্যাট ফেব্রুয়ারি, okay. And information and counseling, menstrual hygiene also, it usually runs by Ministry of MOHFW. What is the aim? Adequate knowledge and information about menstrual hygiene, access to high quality sanitary napkins. What are the key activities? Community based health education and outreach, ensuring regular availability and sourcing and procurement of the sanitary napkin. As I said, 6 rupees for 1 packet, and the packet contains 6 packs. Six sanitary napkins, okay, 1 packet contains. And also the storage and distribution, training in health and safe disposal. How to dispose the sanitary napkin, this is also one teaching. If incinerator is not available, how and where to dispose it, that is also one part of MSH, okay. These are the activities you have to do in Adolescent Friendly Health Day, okay. What are the participate in fun activities? There will be sports competition, healthy cooking demonstration, role play, talk show, screening of short films and videos, even quiz competition. কুইজে হচ্ছে এখানে 1000 টাকার উপরে হচ্ছে কি প্রাইজ দেওয়া হয়, ঠিক আছে, প্রচুর টাকা হচ্ছে কি এখানে ইনভেস্ট করা আছে RKSK তে। Get informed and avail counseling services on nutrition, mental health, gender based violence, non communicable disease, sexual and reproductive health, substance misuse. Also take charge of your health by these counseling services. Also availability of sanitary napkins, iron tablets, albendazole, anemia testing, know your height, weight and BP, and any health services you need, that is for NCD. Okay, but ultimately দিনের শেষে কি হয়, এই কাউন্সেলিং সার্ভিসে যে বসে ছেলের দল কেউ আসে না, বাকিরা এসে বলে যে আমি মোটা হয়ে যাচ্ছি, কি করে রোগা হব বলো, ঠিক আছে, যতই বোঝানো হয়। দিস ইজ দ্য প্র্যাকটিক্যাল রিয়ালিটি। These are the posters. Complete, okay. So there are multiple short notes, that is WIPs, Adolescent Friendly Health Days, to all over the objectives and targets or the factors, that 7 C's of RKSK. Multiple things important in this chapter, okay. Please go through it by tonight. Only the adolescent part of RMNCH+A. Please go through it. I will share the PPT by the evening. Please go through it, okay.